But this is interesting. So if you look at some of these conditions, and this is not all inclusive, but some of these are the more common ones we see today in clinical practice. So things like GI infections, and even now talking about Crohn's disease and irritable bowel syndrome. We talk about cancer and some metastases, chronic infections, inflammation, organ transplantation, autoimmune disease, neuroimmune disorders, metabolic syndromes, diabetes, talking about a burn and hemorrhagic shock, all of these different things, and a lot of the fat disorders that are out there. So a lot of these are not related at all, but the common theme that all of these have in common is this: lymphatic dysfunction. Because when you think about what the lymphatic system does, it is there to regulate immunity and inflammation. It is our body's recycling system. And so when we have these components going on, we kind of forget that maybe the underlying cause, or what's really involved with a lot of these down underneath, is lymphatic dysfunction.